Hello, everyone, and welcome to another audio podcast in this series, the LabTronix series. And this is another RPSG and KNR's collaborative with a Storm Ballistix production as part of the Ballistix Edition. This is an audio podcast in and around renal and psychology related topics. So to begin with, I'm going to highlight some aspects in regards to screening strategies. Now, two main sort of strategies for screening. For example, anxiety and other related sort of concerns in patients with CKD or end-stage renal disease are used. So number one is there's a conservative approach to screen patients with signs of anxiety or depression, and these signs can include social isolation. So, for example, withdrawal from family, friends, and social gathering, changes in mood or physical functioning, and/or increasing physical complaints, sleep disturbance, decreased self-care, including poorer compliance with care in line to care pathways. And number two is that it is more aggressive. It is a more aggressive sort of strategy, but to screen all new CKD patients and those who are suspect or high risk for not just CKD but also end-stage renal disease patients periodically every 6 months to about a year for anxiety or depression, for example, by implementing particular and appropriate sort of screening surveys or questionnaires. And there's works actually out there that have been evidenced and documented in the specialty by a number of authors who are renowned sort of in this sort of field of sort of nephrology practice as well. Now, in line with this, patients who sort of screen positive for anxiety or depression should be referred to qualified professionals to confirm a diagnosis with an appropriate clinical interview. Patients who require immediate referral to sort of mental health professional or emergency psychiatric services include those, for example, who might be susceptible, vulnerable, suspect, or high risk for suicidal ideation, plan, or intent, and those with anxiety or depression complicated by, for example, conditions known as psychosis or mania. And so there are works by Shirazian and team in 2017 that look into this. And in context of diagnosis, now I mentioned, for example, sort of questionnaires or surveys, and now in context of psychology, gold standard, there's a gold standard to diagnose sort of anxiety or depression in through a clinical interview surrounding a few sort of surveys or questionnaires, and some of those are highlighted in this slide here, and generally depending on the sort of nephrology practice that is implemented in any given sort of any department of nephrology, whether it be albeit in adults or pediatrics. Generally those who are qualified to prompt the appropriate questionnaires, etc. They implement the sort of the routine as part of the practice that is in part alongside the sort of clinical team that they are sort of part of. And Anxiety in CKD or chronic kidney disease is highly prevalent in patients with CKD in CKD and end-stage renal disease, and the prevalence the prevalence of anxiety has been highlighted to be 3 to 4 times higher in patients with CKD and end-stage renal disease compared to the general population, and perhaps 2 to 3 times higher compared to individuals with other chronic illnesses or other sort of long-term health conditions. And in context of anxiety and outcomes, so the majority of studies or several studies have highlighted or reported that patients with end-stage renal disease have reported an anxiety that is associated between sort of poor psychosocial and medical outcomes. So in addition to sort of mortality, anxiety in patients with end-stage renal disease has been significantly associated with sort of other adverse medical outcomes, including emergency department visits, hospitalizations, for example, cumulative hospital days, cardiovascular events where that might be evident, and withdrawal from dialysis or renal replacement therapies, and also including, unfortunately, suicide as well. So anxiety has been associated with poor psychosocial outcomes in patients with end-stage renal disease, and alongside this, again, higher depressive, in line with anxiety, there's higher depressive symptoms that can be associated with lower quality of life as well. So some of the mechanisms of anxiety, and I'm just going to provide a few points on this. Challenges associated with renal replacement therapy, such as, for example, traveling to renal replacement therapy sort of sites, for example, 3 times a week, or even performing renal replacement therapy in the home setting. Functional impairment and physical symptoms caused by chronic illness may also contribute to the development of anxiety as well. The psychological or psychosocial burden even of having an illness that affects future morbidity and mortality may also lead to anxiety. In context of healthcare generally, in patients with chronic conditions, treatment with sort of antidepressants, for example, or psychotherapy and there is some literature to highlight that that can significantly improve depressive symptoms and psychological outcomes. Patients suffering from CKD, chronic kidney disease, or renal insufficiency often present with unusual psychological problems with treatment methods that vary on an individualized basis, and sort of pharmacotherapy or pharmaceutics. And so a broad variety of antidepressants or those sort of agents that are available for the management of anxiety have been evidenced as useful. Each of the sort of pharmacotherapies that are available may have different effects on the disease course, but most are generally safe as documented in literature. And there is some works out there, at least historically or retrospectively, around anxiety and something that has been referred to as panic syndrome. And so extreme anxiety and somatic symptoms such as breathlessness, palpitations, chest pain, sweating, and fear of dying can occur in CKD recipients. And the process of renal replacement therapy and a multitude of sort of potential medical sort of complications give the patient a sense of where patients generally have have higher sensitization to anxiety, or anxiety related sort of conditions. And pharmacological management generally has been documented as sort of paramount in the management of anxiety and panic. Many patients with anxiety sort of also tend to experience what has been referred to in literature as insomnia or insomnia related symptoms and insomnia. Now, coping is another sort of aspect in context of sort of renal and psychology related sort of topics. And so coping is generally a response, but also a strategy used to regulate the effect of different types of life stresses on psychological as part of psychological responses. And there's works by Subramanian and team in 2017 that have documented some of this, some aspects around coping, and evidence of sort of coping strategies employed by individuals in dealing with chronic diseases could help explain differences in disease survival rates and ability to adjust to the challenges experienced while living with chronic disease. Optimism may have direct psychological effect on the neuroendocrine system and on the immune system responses, and indirect effect on health outcomes by promoting protective health behaviors, adaptive coping strategies, and also enhancing sort of a positive attitude or mindset as well. In context of this as well, there's health-related quality of life, or HRQOL. So HRQOL has been considered as an indicator of physical and psychological well-being in chronic illnesses, and also a strong predictor of morbidity and mortality. And this works by Deretna and team in 2013 that look at the works around HRQOL. And the concept of quality of life covers sort of psychological well-being, containing the cognitive component that refers to the overall state of satisfaction, and the affective component as well. So once again, I want to say thank you for tuning in on this audio podcast in and around renal and psychology related aspects. And this slide set here, this slide, I'm just highlighting a few acknowledgements where there's been collaborative efforts and co-development around this work. So there's colleagues who represent the from an academic institution and the RPSG, and also KDARS, KDARS for kids. And once again, this has been the Shientist, and this has been an audio podcast, part of the series, the LabTronix series. And once again, this has been another Storm Robotics production. Thank you.